Hey everyone, and welcome to this deep dive. Today we're going to be looking at shockwave therapy.
Yeah, it's really a fascinating area, and especially, with how it can tackle a challenge like inflammation.
Oh yeah, inflammation. I mean, we hear about it all the time, but for this deep dive, we should probably start with the basics, like what IS it and why is it such a big deal?
Yeah, you're right. It's a word that's thrown around without really understanding
Yeah.
what's actually happening. So to put it simply, inflammation is your body's natural response to injury or irritation. It's kind of like an SOS signal bringing in, like the white blood cells and all the helpers to try and fix the problem.
So it's a good thing,
Right.
right? Like it's our body's way of protecting itself.
Yeah, exactly. In the short term, it's crucial, for healing. But here's the thing. When inflammation becomes chronic, it's like that SOS signal just gets stuck and the troops never stand down.
Oh, so that's where we run into trouble.
Yeah, exactly. Chronic inflammation is linked to so many health issues, from everyday aches and pains to serious things like heart disease, arthritis, even some cancers.
Wow, okay, I knew it was bad, but I didn't realize it was connected to so many different things.
Yeah, it's a real epidemic, and it's a major driver of global healthcare costs.
So what can we do about it? I mean, obviously there are meds and treatments and stuff, but those often have side effects.
That's true. That's why there's so much excitement around shockwave therapy. It offers a potential solution that's non-invasive, no drugs, and it tackles the root cause by, getting those healing mechanisms going.
Okay, so let's talk about that. We've got some great sources here, including SoftWave's own website and some pretty in-depth research on, the cellular effects of shockwave therapy. And I've got to say, the more I learn about this stuff, the more fascinating it gets.
It's remarkable how shockwave therapy actually works. So essentially, it delivers these targeted energy waves to the injured area.
Right.
And then those waves trigger all these biological responses that promote healing.
So it's kind of like a jolt of energy that jumpstarts the repair process?
That's a great way to put it.
Yeah.
Yeah, these waves, they're like a wake-up call for the cells in that area. And one of the really exciting things is how they stimulate something called mechanotransduction.
Mechano. What? Okay, that sounds complicated.
It's a big word, but the concept is actually pretty simple. Basically, it's how cells sense and respond to mechanical forces, in this case, the force of the shock waves.
Oh, okay. So it's like the cells are going, hey, something's up. We need to take action.
Exactly. And that action involves this whole symphony of cellular processes all working towards healing. We're talking increased blood flow, reduced inflammation, and even the activation of stem cells.
Hold on, stem cells. That's like the holy grail of regenerative medicine.
It is. And what's remarkable is that shockwave therapy, specifically LIESWT, which is what we're looking at in this research, has actually been shown to stimulate the production and activity of stem cells right in the treated area.
So it's not just speeding up healing, it's regenerating tissues on a fundamental level.
Exactly. And that's what makes this so groundbreaking. It's not symptom management. It's tapping into the body's own repair mechanisms for real healing.
Okay, I'm starting to see why there's so much buzz around this. But let's back up a bit and talk about SoftWave and where they fit into all this. They've got this patented technology that seems pretty unique in the world of shockwave therapy.
They do. SoftWave uses a really specific type of shockwave delivery. It's unfocused. So instead of pinpointing one spot, it creates this broader and deeper treatment zone.
So like a wide net that captures more tissue.
Exactly. Their website says their patented reflector design creates a zone up to 7 centimeters wide and 12 centimeters deep. That's pretty impressive coverage.
Yeah, and they're saying this lets them treat a wider range of conditions, from common soft tissue injuries to things like stress fractures and even chronic wounds.
And that broader coverage is a big reason why SoftWave's gained traction. It offers a level of versatility and effectiveness that's pretty unique.
Okay, so we've got incredible technology backed by some fascinating science. But how do we know it actually works? I mean, anyone can make claims. Where's the proof?
Well, that's where the research comes in. This paper goes deep into the cellular mechanisms of LIESWT, and the findings are really pretty remarkable.
All right, I'm ready to get into the nitty-gritty. What were some of the key takeaways that jumped out at you?
Well, firstly, it confirms what we've been saying about LIESWT triggering those cellular pathways crucial for healing.
So not just theory. There's actual evidence.
Exactly. And they go into detail about how it stimulates cell proliferation and migration, meaning the cells are multiplying and moving to the injured area to repair the damage.
So it's like sending in reinforcements to rebuild that tissue.
A great way to visualize it. And there's more. The research shows LIESWT promotes angiogenesis.
Angiogenesis. Remind me what that is again?
Angiogenesis is the formation of new blood vessels, essential for delivering oxygen and nutrients. Think of it like building new roads to bring supplies for the rebuilding effort.
Ah, that makes sense. So the cells are multiplying, moving, and now we've got fresh blood coming in to support them. It's like a well-coordinated construction project.
It is. And all because of those targeted energy waves. But here's where it gets even more interesting. The research also highlights LIESWT stimulating production of something called BDNF.
BDNF.
Okay.
What's that all about?
BDNF stands for a brain-derived neurotrophic factor, and it plays a critical role in the growth and survival of nerve cells.
So important for nerve health.
Yeah. But more than that, BDNF's involved in pain modulation and reducing inflammation.
So it's like this multitasking molecule that helps with healing, nerve regeneration, and pain relief all at the same time.
Exactly. The fact that light ESWT can boost BDNF levels is another sign of its potential as a real therapeutic tool.
This is so fascinating.
Yeah.
It's amazing how something as simple as energy waves can trigger such a complex healing response at the cellular level.
It truly is remarkable, and this research really highlights what SoftWave is doing. By stimulating these natural processes, they're helping people tap into their body's ability to heal.
So it's not just hype. There's real science behind it. And I'm guessing this research is just the tip of the iceberg. What other possibilities could shockwave therapy unlock in the future?
That's a great question, and I think we're just scratching the surface. There's research exploring its potential for treating a huge range of conditions, from neurological disorders to even cosmetic applications.
Wow, it seems like the possibilities really are endless.
It might just be. And as our understanding of this tech grows, I think we'll see even more exciting breakthroughs in the years to come. But for now, I'm really eager to delve deeper into SoftWave's technology and how it's being used to help people today.
Me too. I'm especially curious to hear some real-world success stories. All this science is great, but I want to know how it's impacting people's lives. So let's take a break, and when we come back, we'll dive into some of the amazing things SoftWave is doing to help people overcome pain and regain their mobility.
Sounds great. I'm looking forward to sharing some inspiring stories with you. Welcome back. Before the break, we were really digging into the science and those cellular mechanisms and how they can actually jumpstart healing.
Yeah, and all that talk about stem cell activation and BDNS really got me thinking. It's amazing that we have this ability to heal. And shockwave therapy is like giving our body the tools to do it even better.
It's like we're unlocking this hidden potential.
So we talked about the research, but what I'm really curious about now is how that translates to real-world results. Science is great, but what matters is how it's helping people.
Absolutely. The research is the foundation, but the proof is in the pudding, as they say.
And I'm guessing SoftWave has a lot of pudding to show for their work based on all those testimonials on their website.
Oh, they do. And what's really interesting is the diversity of conditions they're treating. It's not just limited to one type of injury or age group. They're helping people with everything from plantar fasciitis and tennis elbow to chronic wounds and even stress fractures.
Yeah, I was reading a case study on their site. This woman who had plantar fasciitis for years, she tried everything. Rest, ice, stretching orthotics, even cortisone shots. But nothing gave her lasting relief.
It's a common story, unfortunately. Plantar fasciitis can be incredibly stubborn.
But then she tries SoftWave. And after just a few treatments, her pain was way down. She could finally walk without that ache in her heel.
And that's the thing about SoftWave, because it's addressing the underlying issue, the inflammation, the tissue damage. It's not just masking symptoms, it's promoting real healing.
So it's like fixing the problem at the source, not just putting a Band-Aid on it.
Exactly. And they have similar success stories for other conditions, too. There was one about a runner with Achilles tendonitis. He was desperate to get back to training, but the pain was just too much.
Oh, I can relate to that. I had Achilles tendonitis a while back, and it was rough.
Well, this runner was skeptical at first, but after a couple of SoftWave treatments, he was amazed. His pain was gone, and he could gradually increase his mileage with no setbacks.
Wow, that's impressive. And I'm guessing those aren't isolated cases.
Not at all. SoftWave has tons of patient testimonials, and the common thread is this feeling of relief and gratitude. People who've lived with pain for years are finally finding a solution that works.
It's got to be rewarding for the practitioners using SoftWave to see those results.
I'm sure it is. Imagine being able to offer your patients a treatment that's non-invasive, drug-free, and has the potential to change their lives.
It's like empowering people to heal themselves.
That's a perfect way to put it. That's what I find so compelling about SoftWave. It's not just technology. It's about restoring hope and giving people back their quality of life.
And speaking of technology, I want to go back to something you mentioned earlier about SoftWave's reflector design.
Yeah.
Creating a broader treatment area than other devices.
Right. That's one of the things that makes them stand out.
So how does that translate into actual benefits for the patient?
Well, for one, it allows for more comprehensive treatment. Instead of focusing on one point, they can target a larger area, which is important for things like widespread inflammation or multiple trigger points.
So it's like casting a wider net to catch all the problem areas.
Exactly. And it's especially important for things like plantar fasciitis, where the pain can go all over the foot.
Yeah, that makes sense. But beyond coverage, are there other advantages to using a broader shockwave?
Well, there's some research suggesting a broader shockwave might be less likely to cause discomfort during treatment.
That's a plus. I know some people get nervous about shockwave therapy thinking it'll be painful.
I understand that, but actually, SoftWave treatments are generally well tolerated. Patients might feel a light tapping or tingling, but it's not usually painful.
And the fact that treatments are so short, like 5 to 10 minutes, definitely helps.
Absolutely. It's quick and convenient, easy to fit into a busy schedule.
Okay, so we've got the science, the testimonials, the technology. I'm starting to get a good picture of what SoftWave is all about.
And it's a pretty compelling picture. They've got the research, the results, and the tech to back it up.
But I do have one more question. We talked about how shockwave therapy activates stem cells, which is pretty mind-blowing.
It is. It's like tapping into those reserves the body has for repair.
So how is SoftWave harnessing that stem cell power? Are they doing anything specific to enhance that?
Well, SoftWave doesn't specifically isolate or inject stem cells. The way their shockwave technology works, as we've been talking about, stimulates those natural processes that lead to stem cell activation.
So it's like creating the right environment for stem cells to thrive.
Exactly. Increasing blood flow, reducing inflammation, stimulating activity. It's like SoftWave sets the stage for the body to do what it does best: heal.
Like giving it a little nudge in the right direction.
And sometimes that's all it takes. The body can heal incredibly well, but it needs help to get started.
And SoftWave is providing that helping hand.
Precisely. And the results are clear. People are seeing real pain relief, better mobility, faster healing, all thanks to this innovative technology.
It's inspiring to see how SoftWave is changing lives. And I'm sure there are so many more success stories out there.
I agree. This is just the beginning for shockwave therapy and SoftWave TRT.
Well, this deep dive has really opened my eyes to what this technology can do. I had no idea how powerful and versatile it could be. And SoftWave is clearly a leader. It's inspiring to see how they're using it to help people overcome pain, heal faster, and get their quality of life back.
It really shows human ingenuity and how we never stop trying to improve health and well-being.
And for anyone listening who's intrigued by what they've heard today, I encourage you to do your own research and talk to your healthcare provider to see if SoftWave might be right for you.
It's definitely worth looking into. SoftWave offers a safe, effective, non-invasive alternative to those traditional treatments. It could be the key to unlocking your body's own healing power.
Thanks for joining us on this deep dive into shockwave therapy and SoftWave TRT. Until next time, keep exploring, keep learning, and keep diving deep. Okay, we're back and ready to wrap up our deep dive into SoftWave TRT. I'm really excited to get into the specifics of what conditions it can actually treat. We've covered a lot of ground with the science and the patient stories so far.
Yeah, we have. And now we can really zero in on how SoftWave is being used in different areas of medicine. It's amazing how versatile this technology is.
You know what really struck me when I was prepping for this was how many FDA clearances SoftWave has gotten for different conditions. That's got to be a good sign, right?
Oh, absolutely. It shows that it's gone through serious scientific evaluation and that it's safe and effective for a bunch of different uses. It's not just anecdotal. It's backed by solid research and regulatory approval.
Okay, good to know. So let's start with like the bread and butter of SoftWave musculoskeletal conditions. We talked about plantar fasciitis and Achilles tendonitis, but what other things can it treat?
Well, think about all those aches and pains people deal with. Tennis, elbow, golfers, elbow jumpers, knee, rotator cuff tendonitis. SoftWave can tackle those. They all have inflammation and damage to soft tissues, tendons, and ligaments, which is exactly what SoftWave is designed for.
So it's like a one-stop shop for all those sports injuries and overuse problems.
Pretty much. And the best part is it doesn't just cover up the pain. It actually promotes healing by getting to the root cause.
Right, we talked about that. It's not a Band-Aid. It's about helping the body repair itself.
Exactly. And there's a lot of evidence that it works. Studies show it can really reduce pain, improve range of motion, and get people healing faster.
That's great news for anyone who's been dealing with these issues, especially if other treatments haven't worked for them.
For sure. It gives people a new option when they've been struggling with chronic pain and not being able to move the way they want.
You know, one thing that really caught my eye was using SoftWave for stress fractures. That's bone, not just soft tissue. How does that even work?
That's a great question. It shows how SoftWave goes beyond just tendons and ligaments. Remember when we talked about angiogenesis, the formation of new blood vessels?
Yeah, like building roads to bring in supplies for healing?
Exactly. Well, that's essential for bone healing, too. Those new blood vessels bring nutrients and oxygen to help the bone grow back stronger and faster.
So it's like giving the bone a turbo boost to heal.
Yeah, that's a good way to think about it. Research shows SoftWave can speed up fracture healing, which is huge for athletes or anyone who wants to get back on their feet. ASAP.
I bet. Especially if you're someone who's really active.
Totally. And because it's non-invasive, it's way easier on the body than surgery or other more aggressive treatments.
Speaking of less invasive, I know SoftWave is used for wound healing too, which seems like a totally different thing. How does that work?
It's pretty amazing, isn't it? The same tech that heals tendons and bones can also help wounds heal faster, even chronic ones. And it all goes back to those basic mechanisms we talked about.
So the increased blood flow, the cell growth and repair, all that helps wounds too.
Exactly. And for chronic wounds like diabetic foot ulcers or pressure sores, it can be a game changer. Those wounds often don't heal well because of poor circulation and tissue regeneration, but SoftWave can jumpstart those processes and get things moving.
That's incredible. It gives hope to people who might think their wounds will never heal.
It does. And SoftWave actually has FDA clearance for treating diabetic foot ulcers and burns, which shows how effective it is.
Wow, it's amazing how this one technology can help with so many different problems. From muscle and bone injuries to stress fractures to chronic wounds, it seems like there's no limit.
It's a really versatile tool. And as research goes on, I think we'll find even more uses for it. There's already some exciting research looking at its potential for erectile dysfunction and Peyronie's disease.
Oh, wow, that's interesting. Tell me more.
Well, it's still early, but the idea is that SoftWave can improve blood flow and tissue regeneration, which could help with the underlying causes of those conditions.
That makes sense given how it works at the cellular level.
Exactly. And while more research is definitely needed, the early results are looking good.
Well, it seems like the possibilities really are endless. Who knows what kind of breakthroughs we'll see as scientists keep exploring this.
I'm definitely excited to see what the future holds. It's a field with a lot of promise, and SoftWave is leading the way.
This deep dive has really opened my eyes to how powerful and versatile shockwave therapy can be, and SoftWave's technology is clearly at the forefront. It's inspiring to see how they're using it to help people get rid of pain, heal faster, and just live better lives.
Couldn't agree more. It really shows what we can accomplish when we keep pushing for better ways to help people.
Absolutely. And for anyone listening who's interested in learning more, I encourage you to do your own research and talk to your doctor to see if SoftWave might be a good option for you.
It's definitely worth looking into. It's safe, effective, and non-invasive.
Yeah.
It could be exactly what you need to unlock your body's natural ability to heal.
Thanks for joining us on this deep dive into the world of shockwave therapy and SoftWave TRT. We'll see you next time.